Hi, my name is Dr. Darren Mitchell. I'm a chiropractor. We have a new patient who's never been to a chiropractor, Vanessa. She's agreed to let us film her so she can get this whole experience. Now, she's apprehensive about chiropractic. She's never been to a chiropractor. She's heard some things on the internet, read some things, and so she's not the most excited about this experience she's about to have. But we're going to walk her through an exam. We've already done a good history on her. Basically, she's been having some neck pain, some upper trap pain, some more pain on the right, and she's been having numbness and tingling goes down her right arm, and she's been having headaches. No significant accident. She says she slept wrong on a pillow, and it's just been something that she's been dealing with progressively, and it's been getting worse over time. And so we're here to try to see if we can't figure out what's going on. So right now we got Vanessa standing in front of the mirror, and we're looking at her shoulder height and we're looking at her scapular heights. And it looks like she's a little bit lower on the right as compared to the left. Are you right-handed or left-handed? Okay, so sometimes the lower scapula on the right is a normal finding. Sometimes it can be a position issue called a cervical brachial traction, which is what I'm kind of suspicious that she might have. So we look at her here, we're gonna come up and we're gonna just palpate on the neck just a little bit to see she's got some tender spots right there and there a little bit, right? Because she has some numbness and tingling going down her right upper extremity, we wanna kind of palpate certain tissues that can be associated with pressing on different nerves or arteries that feed the arm. So we're gonna go in here, we're gonna palpate her scalene on the right, which we can feel here. There's an anterior and a medial serratus muscle right there. Pec minor is another one we want to look at that gives you some tenderness when I press there. That's also a big culprit of some things that can go down the arm. Of course, we're looking for pinched nerves that might affect the cervical spine, so we're going to rule those out as well. But one test that we're going to do is we're going to check her circulation, and we're going to see her pulse down here on the radial pulse. As I bring your arm back, turn your head to the right, take a big breath in, hold it. Does that give you any numbness or tingling?
A little bit.
And it does, and I feel a decrease in your pulse right here. So what that is a condition that we're looking at called thoracic outlet syndrome. So it's a very common clinical diagnosis where we have some interruption of nerve and artery that can go down and defeat the arm, okay? Now, what we're gonna do now is that now that I've seen her posture, she's also got some anterior rounding, and she's holding her hands in front of her body right here, okay? So that's what we call an upper cross syndrome, a forward head carriage, where her head is shifted forward in front of her neck. Someday when we get her feeling really well, we're gonna wanna get her shoulders back and down, okay? And we're gonna reestablish that her head sits back on top of the spine, just like that. So that way the head is supported by the cervical spine, which is over the shoulder, which is over the hips, which is over the ankle. So that's a very important thing that we have to look at is posture. Many times when people go to chiropractors, they get short-term relief, but they say, hey, look, I gotta keep going, I gotta keep going, I gotta keep going. Once you start going, you always gotta, that's not necessarily true. If you actually fix the foundational problems and the posture issues, you may not have to come back near as frequently, okay? All right, let's have a seat right here. Now what we're gonna do is we're gonna run through her medical exam. We're gonna do an orthopedic neurologic evaluation of her spine. First thing I need you to do is have you bend your head forward as far as you can go. Does that give you any pain, any stiffness?
A little bit between the shoulders.
You can feel that back there, okay? Opposite, can you go back? How far can you go? All right, not too bad, but a little stiff there. Now look straight ahead. I want you to look to the left now. How far can you go? Pretty good there. And then over here to the right. Not as good there. So you're a little shorter on that right side as compared to the left, okay? Next thing we're gonna do is I'm gonna push down on your head. Does this give you any pain or discomfort that goes down into your arm?
No.
No, good. Now the opposite, I'm gonna pull up. Does that feel better, worse, or no different?
Feels better.
Feels a little bit better, okay? And the thought behind that is compressing your spine, if you had a disc, would increase that disc pressure that might push on the nerve. Pulling up, contraction that disc back in, taking some pressure off again, okay? Next thing we're gonna do is go into some reflexes here. We're gonna check her reflexes here, which is a good 2 out of 2 on both the biceps, brachioradialis, and triceps. So all those reflexes are very good. They're not too jumpy, and they're not too low either. Again, C6, C5, C7, all that's very good. If we come down here, we can just make sure that, we're good down there too. All right, so reflexes are well established. Again, you mentioned some numbness and tingling on this side. Little pinwheel here, can you feel this?
Yes.
Does it feel comparable to this? Okay, and then we're gonna come down to another dermatome here. You probably feel pretty sharp there. That's our C7. You can feel this, C8, T1, okay? C8, T1. Now we can do C5, and stuff up here, but I'm not too worried about, that as well. So all her reflexes look good, her sensation is good. Now we're gonna check some muscles. I want you to hold your elbows up. Don't let me push down, resist. Very strong, arms up in front. Pull towards you, very strong. Push towards me, very strong. And towards you, and towards me. Good. Hold your fingers out tight. Keep your fingers up, very strong. And squeeze for me. Awesome. Okay, so we check C5, C6, C7, C8s, and T1. So these are the big things if you went to a real doc or neurologist or neurosurgeon, they would want to see if I had a pinched nerve, certain muscles would be weak. I might see a certain pattern of numbness, and I might see a difference in the reflexes. So you're clear from all that right now. So we've kind of taken you out of the medical world. So now we're kind of back into our functional dysfunction. All right, now I want you to lie on your back for me. We've cleared her from the medical side. Now we want to go into more of the chiropractic, looking for some of the dysfunction that she may have that are giving her symptoms. So we want to check some different joints, and we're going to use some muscles to actually test for that. So we're going to take your arm in. I want you to hold that position right there. I want you to keep it tight for me. I want to pull this way. You're going to pull towards that mirror. Ready? Pull tight. Resist. All right. That's not very good. Okay. Let's do this next one. Hold that position right there. Don't let me push down. Resist. That's not very good. Hold this position. I want you to go up toward the ceiling. That's not very good. And then now I want you to pull towards you. That one's good. Okay, so what I checked was muscles that's across your AC or SC joint, your AC joint, and your shoulder joint. So I'm checking a couple different muscles across different joints. So we're gonna check that because I wanna make sure that the other side is okay. All right, we're gonna hold that right there, pull straight across. Okay, that one's much stronger, would you agree? Okay, bend your elbow, don't let me push down. Very strong, hold that right there, push up. Very good. So now this is a classic example. This side's doing well, but this side that had the shoulder going down and all your symptoms is not doing as well. The way I would explain that to you, I kind of use this light trick. On the left side, your muscles are doing this. They got full power coming from the system, right? On your right side, they're doing that. They're on, but they're not fully functioning, okay? All right, now we kind of know what we're dealing with. We're gonna come in and we're gonna palpate. We want to feel some areas of tenderness like that right there, that right there, that right there. Okay, so chiropractors, we're looking for joints that aren't moving or joints that are a little stuck or what we call a subluxation many times. It's a different term than medical doctors, but it basically means a joint restriction or an area where the joint isn't moving as good. And so when it doesn't move as good, it locks itself down. When it locks itself down, it doesn't move as good, right? So guess what? You've been in this vicious cycle for a bit, okay? So what I would like to do to Vanessa on her first adjustment is, I want to do a neck adjustment. I want to adjust her clavicle, her shoulder. I want to get between her shoulder blades. I want to release some of these tight muscles, and I want to work on her posture. Those are my things that I would want to do for her. But before we do that, we need to make sure that she's okay with being adjusted. So one of the things that people are worried about when they get a cervical adjustment is the vertebral artery that runs up through the transverse foramen of the cervical spine. And there have been times on rotary adjustments when you put a position in there that have caused some damage to that artery. But Vanessa and I have been talking about this, and we try to explain to patients, it's a very safe procedure. Malpractice companies, don't charge us astronomical rates. The incidence is 1 in 8 to 12 million, but we always want to put the patient in a pre-test just to make sure that we don't get any weird neurologic symptoms. Does that give you any sensations, any problems? Okay, perfect. And we're going to do that back on this side. Is that okay? All right. So, with her consent, I would like to do a manipulation to your neck. Are you okay with that?
Yes.
All right. So I'm going to do a similar position as just what I did. Now you're going to hear a little bit of a pop, and it's going to seem really loud because it's right there by your ear, okay? But I promise you this is not the Jackie Chan move of death, okay? If you can just really relax everything for me, we're going to put her through this, a little click, just like that. Was that too terrible?
No.
It wasn't bad, was it? All right, we have one more over here, and we're going to pop that right there. All right, you did great. Can you still move your toes?
Yep.
Perfect. So we're not hurting anybody over here. All right, so now we've cleared the neck. Now we need to work on the shoulder a bit, okay? So this one can be a little bit uncomfortable, but I'll take it easy on you. So we're gonna adjust her SC joint right here. And to do this, I want you to turn your head to the left. I want you to take a big breath in. I want you to let it all out. And we're gonna do a little pop right there. You felt that shift, didn't you? It clicked in, didn't it? Okay. All right, very good. You've been awesome. All right, now I need a couple other things here. Now we're gonna adjust between these shoulder blades where you've been having a lot of that pain. I want you to give yourself a big hug. I'm gonna pull you down just a bit. All right, so now I want to roll it to her side, and we're going to feel these things called anteriors. You can really feel that one right there, can't you? Yeah. So we're going to roll you back here, little drop. Perfect. One more. There it was. I'm going to drop one more down. Perfect. Okay, those are a little tender, but not too bad, right? All right, now almost done. Come all the way up for me. I want you to sit up real tall. Let this arm relax here. We're going to bring this shoulder back, down. Perfect. On your stomach now, face down. Okay. And then we're going to work on her shoulder a little bit. So her shoulder was going down, so I need to get her shoulder blade back up. So I'm just going to mobilize around here a little bit. Good. And then I'm going to push this up. There we go. Kind of felt that too, didn't you? Oh, and there was his cousin. Perfect. All right. Now I'm gonna leave those alone for today since I'm just gonna check everything else. Right, down through there, good job. I got a few more releases there. All right, now I'm done, but I wanna check my work. Line your back again. Let's go face up. And we wanna recheck and see how we did, if we made the right correction or not, okay? So let's recheck the muscles that are weak. Hold this right here, hold that right there, pull across that way, resist. Is that a lot stronger than what it was? I feel it too. Bend your elbow. Don't let me push down. Absolutely strong, right? Hold that right there, push up, push up. Still got a little weakness there, okay? So that tells me one more thing. Now, once you sit up, face that mirror, and we're gonna do one more little adjustment here to her shoulder. And bring that right there. Okay, does this give you pain when I do that? All right, one more, last one. There it went. Right back on your back. And let's see if that did what I wanted to do. Hold that right there, push up, and it did, okay? So that told me something else, and so again, a lot of times when people go to other chiropractors, I don't think they do the post-test to make sure they did what they're supposed to. All right, let's have you stand back up and face this mirror. All right, still with me? All right, now let's see how we did. Scapulas look much more even, okay? How does that tenderness feel? Does it feel a little looser? All right, so it's not gonna be perfect, but it's like what I tell people, you had a sticker in your foot, I just dug the sticker out, it's a little uncomfortable, and now we need to let the tissues heal in, okay? And so that's where we would have our follow-up visits. Now, I'm gonna immediately give her some homework because I want this to go away and I wanna see 5 of Vanessa's friends because I don't wanna manage your pain, you know, I wanna get you and get you better, so we're gonna do that. So, we're gonna work on opening up your tight chest muscles, okay? So we can get our shoulders back and down, and then we can keep our head back on top. And then we're gonna take this pressure off this muscle right here so that it doesn't cause any more numbness and tingling. All right, so, we're gonna come over here to this corner. I'm gonna demonstrate first, and you can do it. You're gonna put your arm against the wall like this and like this. Put one foot in front, keep your head above your shoulders, and you're gonna lean in with your chest. And I don't want your neck in there, and I don't want you to arch your back, but just lean in, hold that position for 10 seconds, take a breath, let it out. Going a little further. One more time. So our goal is to get our chest all the way in that corner. We wanna do it above shoulder height, at shoulder height, below shoulder height. Your turn, that will be a test. Good, elbows against the wall, one foot in front, doesn't matter which, keep your head back, keep your hips back. See how tight you are? I went in further than you did. That's okay, well, we see this all the time. But you're making good gains there. Good, and one more. So that's how the level of stretch I want you to feel, okay? So anytime, and then again, just to reiterate, you're gonna go above, at, and below. All right, last thing, let's stand in front of this mirror one more time. So now we've got an exercise for this. We wanna practice getting into new posture, and that's gonna be a habit. And then the last thing that we're gonna wanna do is that we're gonna wanna teach you some exercises here to hold your shoulder blades back so you can do this instead of this, okay? And so many people have poor posture and that's why they keep having issues. But something we see every day, all day long. Yep, computers, phones, we talked about in your history, you sit all day long, so we might make some ergonomic evaluations, get you up every hour or two, have you do some stretches, have you do some strengthening exercises. And I would probably recommend you come in twice a week for 2 or 3 weeks. You did great.
All right.
Yeah.
And I can move.
And you can move, and hopefully you feel better. And your range of motion just got better too, because you were limited on that right rotation. So that's what chiropractic is. Don't be scared. All right, Vanessa just got her first adjustment, and so we're gonna discuss now post-treatment expectations, you know, because a lot of people say, hey, once I go to a chiropractor, I always gotta go to a chiropractor. So I'm gonna tell you that there is a thing called muscle memory. You've had this condition based on your history for how long?
A year and a half.
A year and a half. So your body's remembered a position for a year and a half. We just did a major adjustment, and now your body's sitting in a different spot. So we need to see how well your body's gonna hold those adjustments, and that's sometimes the need why you have to see a chiropractor a few more times just to see how your body responds. Now, if you're healthy like you are, you don't have any other significant issues, your nutrition status is decent. I noticed you did take some supplements. I do oftentimes recommend people to take vitamins and minerals and fats and Ds and probiotics because that's what you're made out of. Carbs and fats and proteins and vitamins and minerals and air and water. And if you don't have those on board, these systems don't do as well. Now, occasionally, after your first adjustment, you might be sore. About 1/3 of the population say, man, felt good, but I got some stiffness. That's normal. We broke up some adhesions, we moved some muscles, we stretched some tendons. It's kind of like if you went to the gym and you had 2-day muscle soreness. But most of the time, people just feel great. I want you to get a good night's sleep tonight. You're gonna have the best night of sleep that you've had in a long time, okay? And we'll just follow up maybe early part of next week and we'll see you a couple times.
Okay, perfect.
Any questions?
No.
Awesome.
Thank you so much.